These are 3 examples of calipers that I have used in my clinical practice. On the upper left are jeweler's calipers that have small posts within the jaws that can be aligned on either side of the object to be measured. On the upper right are digital tire thread depth gauge calipers. These are actually my favorite, and I'll talk about these in a little bit. And on the bottom are digital vernier calipers. These are the ones that have most traditionally been used in clinical research and in the laboratory. These are the first calipers that I was trained on to use for basic scientific research. However, they're not my favorite for measuring cutaneous neurofibromas. This is a patient volunteer of mine who has NF1 who signed consent, and we're not revealing any HIPAA-protected personal information about this patient. The patient has some Vaseline on his skin because I recently resected some cutaneous neurofibromas, and we had just removed the stitches. When measuring cutaneous neurofibromas, for accuracy, it's important not to apply too much back pressure to the tumors. You really want the calipers to be balanced on either side of the cutaneous neurofibroma at the point of its widest width, which may not be the base, it might be halfway up the tumor. And you want the calipers to be able to slide freely where they touch the edges of the tumor but are not compressing the edges of the tumor, and this will provide the most reliable results. These are the gemstone or jeweler's calipers. They are spring-loaded so that the jaws remain closed until you manually open them. And as you can see in this demonstration, these are my least favorite calipers to use to measure cutaneous neurofibromas because although the device is small and handheld, it still requires 2 hands to open up the jaws and to approximate them to the tumor, and the whole process is quite awkward. One aspect of the tire thread calipers that I love is that with a little bit of practice, you can actually use either hand and one hand alone to measure the tumors. Use 2 to 3 passes with the calipers until you are confident that the jaws are touching the cutaneous neurofibroma but not compressing it. When you are confident at the width of the jaws, call out your measurement to an assistant who will verbally repeat the measurement and let you know that it has been recorded in a ledger. When choosing cutaneous neurofibromas to focus upon for the purpose of a clinical trial, try to select tumors around which there is visibly unaffected skin to the best of your ability. Tumors that are directly adjacent to a second tumor may obstruct the jaws of the calipers and provide unreliable measurements.